37-year-old Godfrey Ntalo, a resident of Isinjiro, says that he traveled to Kampala carrying hopes of traveling to Somalia, where he was to work as a security guard. Some key prerequisites for the job were a number of health checks, including an HIV test to be carried out at the surgery, a hospital located in Naguru, a Kampala suburb. According to Ntalo, after undergoing all the required tests, officials from the surgery revealed to him that he was HIV positive and immediately told him to start taking antiretroviral medication.
I went to surgery where they told me that I'm positive. They told me that I'm good to work, I'm fit for any exercise if I'm on medication.
Ntalo says the news that he was HIV positive turned his life upside down, beginning with his family leaving him.
I called my wife. I told her that you're the one who brought HIV AIDS. She was like, let me go to hospitals to realize whether I'm positive or negative. She went there, she was negative. She took the kids, I have 3 kids, they were all negative. So she said, let me go back to my father's home because he was sick, you get a disease from Kampala. So you are telling me that I'm the one who brought HIV.
After seeking advice from some relatives, Ntalo says that he visited a number of hospitals and clinics to carry out multiple HIV tests to prove his status. He says all the other tests proved that he was negative.
We went to JCRC. They told me that I'm negative. I went to Kampala International. They told me that I'm negative. I went under 8 hospitals.
He says that he tried to get the surgery to give him an explanation of the discrepancy in results, but he was turned away. This prompted him to seek legal redress. According to Ntalo, court heard the case and preliminarily urged both parties to seek a mediator who recommended that he should take an independent HIV test from the Infectious Disease Institute at Mulago under the mediator's supervision, which he did. The test also came out negative, and he is now demanding for compensation.
To compensate my staff, my job, my rent, my money, and even my life. I'm not okay. I need to go back to the hospital because I swallowed the ARVs.
We spoke to Albert Mukasa, the legal counsel of the surgery, on phone, but he declined to give us a comment on grounds that the matter is still before the courts of law. However, Ntalo's lawyers say that the matter was already preliminarily decided on by court.
The matter is in court.
The matter went to court, and then the court suggested that you people bring it before a mediator.
It is still in court. The matter is still in court. No comment.
Dr. Ekwaro Buku, the president of the Uganda Medical Association, says that although it is not usual to see a patient drag a doctor to court, it is still possible. Obuku also advises patients with grievances to usually seek aid from the Uganda Medical and Dental Practitioners Council.
Yes, the Medical and Dental Practitioners Council is very, very effective because it is run by highly trained, highly experienced physicians from different sectors, okay, from the university, from the medical perspective, from the public health perspective, from the dentist and different aspects. And this council actually has sentenced doctors to one of the biggest punishments, to remove you from the register, and you cannot practice anywhere.
We tried to seek a comment from the Uganda Medical and Dental Practitioners Council to find out whether they had received Godfrey Ntalo's complaint, but their non-available phone lines were unavailable. Sohel Mugabe, NTV, Weekend Edition.